Okay, welcome everybody. I am really happy to introduce you to Nicole Rincon. She is a PA that works out of San Diego area and exclusively, I think, treats children with autism. Is that right, Nicole?
Predominantly, we do have some other pediatric kind of developmental disorders, but it's
Okay.
probably 90% autism.
All
Yeah.
right. Well, go ahead and introduce yourself, and we're going to kind of talk about the initial evaluation you do when a patient comes in. You can tell why you got into this if you want. Just take it from here.
Oh, thanks. Thank you. No, we were talking before we started recording, and it's been like a year we've been trying to connect. So it's
Yep.
an honor. Thank you for talking to me. I really appreciate your time. Yeah, so I'm a physician assistant. I've been a PA for 18 years now, I think, but I've been treating autism for 9. As you mentioned, I work at Rosignol Medical Center. We're actually in Orange County, California. Um, and I initially got into this when my kids, well, to back up, we'd had some difficulty getting pregnant after my husband and I got married. We did some fertility treatments. I got pregnant with triplets. And then triplets, right? Two boys and a girl. They're the loves of my life. They're wonderful. And at 2, they regressed. My son lost, severely regressed, my one son, my middle son. And my daughter started having seizures. And my other son also had a milder regression, and they were all being worked up for autism. So, at that point, I have this typical story that most parents do. They go to their neurologist, they go to their doctor, their pediatrician. They say, "Oh, this is it. Your child's disabled for life. We don't know why. There's nothing you can do. And here's an anti-dopamine drug, risperidone, and you can go home and this is it. Apply for IHSS disability."
Um, Now,
And
were you
I
were
was
you
just
a PA at that time? Had you already
Yes. So
started?
I'd been a PA for, like I said, like 9 years at that point.
Wow.
Yeah, and I had been working in, kind of a wellness center. I'd been doing weight loss and vitamin supplementation and, B vitamin shots and things like that. So I wasn't, I mean, I didn't know anything about autism. I'd heard of it, of course, but yeah, I was appalled. I was devastated, but I just refused to accept it, right? So I was, nope, I'm not taking the meds. I'm not doing this. And so I stayed up like most moms do, or a lot of moms I talk to, till 2 or 3 in the morning, looking at clinical trials. What's the evidence? Why did this happen? What can I do about it? Like, they were healthy kids and they regressed. So there was something that happened, obviously. And no one could give me answers. So essentially I went to um, after trying some things on my own that actually helped a decent amount, I was making a little bit of progress. The first intervention I tried was omega-3 fatty acid. And it actually helped my son stop his self-injurious behaviors. He started to have better eye contact, less repetitive behaviors. And he calmed down, which was a godsend at that time. And so I thought, okay, I'm onto something. There's things I can do, right? That are not just drugs.
And just to put it in context, that would have been about 11 years ago then when they were.
Yeah, they would have been two. Yep,
So
11
about
year ago.
2013 could have
Yeah.
put it in the context of where we were as a medical community on the topic.
Yeah, I mean, this has been around unfortunately, it's been around a really long time. But there was no one I could talk to. I didn't know where to go, so I just went to PubMed because I'm like, well, I'm a clinician. I can read clinical trials. I can do this. So I started to do a few things that were helpful. And I can go down that rabbit hole in another talk, but essentially I said, I think I need more help. I want to do this better. There's got to be somebody else that's done this ahead of me. So then I found out about MAPS, which is the Medical Academy of Pediatric Special Needs. And at the time, I'd went there and the first conference, and at the time, Dr. Rosignol was the founder. He was actually yeah, he was like the CEO or whatnot, the founding member. So I approached him and said, "Hey, I would like a job. Can I work for you? Like, I'll just start next week, if you can." And he said, "Okay, yeah, great. Let me give you a resume." I think his line was, "Are you licensed in California?" And I said, "Yeah, I'm licensed." So I started working there, and I worked there exclusively for the aim of helping my own kids initially. But of
Wow.
course, I'm so, because I'm such a driven person. I would have done anything, and I still would, to cure my kids, or at least just do something in a bright direction. So I did. I took the job and I learned. I went to MAPS. I've been doing this, like I said, for 9 years. So along the way, my son Alexander, the one that severely regressed, he's lost his diagnosis. He lost it a couple years ago. So now he's gen ed, mainstream, lots of friends. I mean, really no artifacts of autism. And my other son is super close. He's there. He's very intelligent. He's like 10th, 11th grade reading level, but very
Wow.
verbal. But he's a little, he's kind of my young Sheldon kind of kid. So, but they're very brilliant kids. I love them and they're doing fantastic. I
And
mean,
you're 13 now.
they're 13 now, all gen ed. But and my daughter stopped having seizures. I mean, we had taken care of that pretty early. So, I mean, it's a blessing. It's literally a miracle that I just didn't think was possible. Everybody told me it wasn't possible, and I'll tell you, it took a long time. I mean, it's been 11 years of doing this, and my son just got gen ed, like put in gen ed like 2 years ago. So this has been it's been a mission.
There wasn't one literally just thing. It was whole just a combination of optimizing their health and you know
There was a lot, and it was ironic because there were different things for each child. I actually, so treating the microbiome, cleaning up the diet was huge for just behaviors and like stimming and attention. So going organic, good fats only, cutting out certain things for a long time. We were gluten and dairy free. And really probiotics they were really yeasty, so I had to treat a lot of fungal growth. It was like 2 years of treating fungal overgrowth, which made a big difference. My one, some clostridia, there's some, bad bugs that we had to treat. But yeah, addressing some metabolism, like we had a lot of copper, increased copper, low zinc, so treating that imbalance. Leucovorin, so I know we can touch a little bit upon it, but I'm going to actually speak at TACA in 3 weeks from today or from yesterday. I'm doing a whole presentation on leucovorin, which is basically prescription high dose folinic acid, which is the active form of folate. That for my one son Ryan was a game changer. It really was. I saw him calm way down. His cognition went way up almost immediately. So when we started it.
So
So I
since you
mean it
brought it
was
up, what's so interesting about your story, the two things
yeah.
that strike me is one, of course, how motivated you were. So
Yeah.
you weren't just helping your patients, you were helping your own family.
Yeah, it was
And,
I was
and
all
it's a,
in.
and it's a controlled, almost a controlled thing because you have three
Yep.
genetically different individuals,
Yep.
but yet they all grew up in the same environment in
Yep.
you and
Yep.
then in their home. And so theoretically, their diet is probably similar
Right.
to each other, much more so. And yet you just said different things worked for them. It
Correct.
different.
Yeah, they even right now have different, they're still on supplements and things
So
and they're on
interesting.
different regimens.
Yeah. Well, since
Yeah.
you brought up leucovorin, just to jump ahead a little bit, so
Yeah.
what were their MTFR mutation differences, if any, or did they?
Yeah, they do have different ones. My son Alex and Vivian, my daughter, they have the same. They have one mutation of C677. And my other son,
So just
Ryan,
one. They're not, or you mean they're homogeneous in the C?
they're homozygous for the C677. I'm sorry, they're heterozygous for C677. So they're not too bad. Their
Oh,
MTHFR
wow.
is not horrible.
And yet the
Um,
leucovorin worked in the one.
yeah. And
Wow.
the one that wasn't, he's only heterozygous for the 1298, which is, it's a little bit. So they have a little bit of methylation problems, but um it's not I think the leucovorin was because we were positive for folate receptor antibodies because we were absolutely positive for them. That
All
my
of it.
boys were yes, and me actually.
Interesting.
So I do believe like, and they were pretty high. We actually had that rare, this is a whole nother talk, but we have the rare soluble binding protein. So we actually had the protein in our blood versus the antibody receptor antibody. So that's a whole nother talk, but basically it's kind of correlated with a high level of antibodies and a high
Wow.
level of blocking folate. And so I think when we started that, it was really helpful. I think they were starving for folate in their brain. And I probably was positive during my pregnancy. It's probably contributed to my fertility issues. Like looking back now, I'm literally talking, like I said, in 3 weeks. And there's a trial that just came out 2 months ago, that I'm presenting that talks about how they treated mothers and it helped with fertility in a case study. And she wasn't able to get pregnant. She did after taking the leucovorin. And then there's another case study that had two moms actually had previous kids with autism. And then they followed on the next pregnancy, they followed them through their pregnancy, gave them leucovorin, and their next children didn't have autism on two different boys. And they followed them up to age 3. So it's probably a bigger issue than I think. And it's probably a bigger issue for a lot of neuropsychiatric disorders in general. It's associated with pandas, OCD, anxiety, depression in adults, fatigue in adults. So I think more people have it than they know.
Yeah, it'd be fascinating to see what leucovorin did to the gut as far as the actual, BIF levels and things like that. It almost sounds
Well,
like
it
it could be
certainly
a
was detoxifying because
prebiotic
I
like
noticed
vitamin D.
when we bumped my son, he always had that white coating on his tongue, and I didn't change anything else. And then it like after being on it for a couple months, his candida went away. His tongue was nice and pink again. I'm like, I didn't even treat his yeast. Now
Yeah.
there may be other factors, but it was doing something metabolically, absolutely. Like
Right.
it was definitely helping his gut. I could tell.
Well, of course, I could jump into a ton of different questions, but let's start very basic. So, one of the things that I hear quite often, and I just heard it recently about a week ago,
Mhm.
from in this case, someone who works in the office that I'm currently working in. She has a 4-year-old.
Mhm.
He's autistic,
Mhm.
and she can't find any doctor to do anything except recommend behavioral therapy. So she came to me getting my ideas. I told her about you. So
Yep.
let's use her as kind of an example. A
Yep.
mom comes into your office, has her 4-year-old, says, nobody will do anything to help him except try to teach him how to behave.
Yep.
What
Yeah.
do they do?
So, and I did, unfortunately, this is almost all my patients. I mean, this is the story, right? Parents that are like, I'm not accepting this answer from the medical community. Um, and so I've done presentations on this for TACA. It's an organization that supports autism. TACAnow.org is the website. But if you look on my Twitter profile, at Nicole Rincon PA, pinned to the top of my profile is an hour-long talk on what a new patient visit looks like. So it's called Common Testing and Treatments for Autism. And so you can look there if you want an hour because it's an hour talk. So obviously I'm
Yeah.
going to abbreviate it,
Well, and also
but
it's on YouTube, so we people
it
can
is on
go
YouTube.
through YouTube
Yeah,
and
and I do have, I mean, I have other things that I've presented on Spotify, on other podcasts. So you can search my name. There should be a lot there for different topics. But and I do have a website, by the way, NicoleRincon.com, where it's actually on my website, front and
oh,
center.
okay. Well, that's a
So
system, NicoleRincon.com.
yeah, and all my main ones, I've been trying to post all of my main podcasts there for simplicity's sake. So NicoleRincon.com. But to answer your question, I mean, it's a 2 hour long visit. So it's a long visit and we talk about a lot. It's very comprehensive. So, I mean, I talk about, pregnancy from, possible regressions, to current symptomology, but then we talk about diet and even like water, what kind of water they're drinking. And, we start usually with testing, various testing. So serum testing, blood testing. So we'll look at a ton of different blood markers, anything from immune function, metabolic function, minerals like zinc, copper, that kind of thing.
Toxicity, heavy
I'm sorry.
metal, heavy metals. You know,
Initially, I usually do a lead screening. Sometimes I'll do a mercury screening initially, but we will see. We usually do that a little later, depending on if the zinc is severely depleted, I find that a little bit correlated with potential metalopathy. So if the zinc is normal, I'm thinking, maybe metal is not a big deal, and I might shelve that. But if the zinc's pretty low, then we may have a higher suspicion for metal toxicity.
now
So
I know we're all deficient in vitamin D and
yeah, that's another one.
are we deficient in zinc
A lot of
generally?
people are. I see it all the time. Now, I am
Wow.
such a skewed clinician because I mean, I'm all autism.
Right.
I mean, so
Right.
I don't know, frankly, what the general population looks like, but yeah, I would, I
So
see it
your
all the time.
population is very high, apparently.
Probably third to half of the kids. I mean, it's a
Wow.
lot.
And it's
I mean,
so, and is it just as easy as a supplement to
yeah.
fix that issue?
Yeah. And it
Wow.
can be a lot. I mean, we need 30, I mean, most kids are 30, 60 milligrams. Some kids even I have to go up to 90 milligrams a day because their zinc is so low. But yeah, I mean, we see a lot of iron deficiency, vitamin D, a lot of omega-3 fatty acid deficiency when we look at it. And we do the normal stuff, liver function, kidney function. We do a ton of testing for mitochondrial function. So that's that energy production. So I'll usually get like a creatine kinase, carnitine, acyl carnitines, ammonia, sometimes lactic acid. And my favorite is plasma amino acids. So that'll look at how well they're metabolizing protein. And really, it can show either genetic markers for, protein deficiencies, and syndromes, but sometimes it can just see what they're functionally missing, from their diet or whatnot. So there's a lot. And so the blood work is first. And then also included in the blood work is the folate receptor antibody test, like we mentioned.
Mhm.
Absolutely. I get 100% of our patients because
Do
most
you
of them are
actually do
positive.
genetic testing, or do you just kind of go to the end result? And if the antibodies are not there, or homocysteine is
Yeah.
usually, as far as I understand, is used, or do you actually check the mutations as well? Or
It's a good question. No, that's great. We check MTHFR. And then that can help guide treatment. We do check homocysteine. And then I'll check the folate receptor antibody test. So I do all three. And
okay.
it kind of gives a picture of how well, in general, you're metabolizing folate. Now, with the genetics, there's a whole nother, I mean, you can do SNPs, single nucleotide peptides. That's a different test. And we also, like I said, for kids, we also can do whole genome sequencing. So there's a lot of different genetics we can test. But those are initially we'll get MTHFR and then the FRAT test, that folate antibody test. Most kids are positive, and I usually just start most kids on the first visit on leucovorin because um, most kids are positive, and the literature is fantastic. The meta-analysis show it helps with speech, social, attention, repetitive behaviors. I mean, it hits all of the major issues with autism, the core symptoms. Um, and then even if the
I'm
folate
assuming there's
receptor,
no downside to leucovorin, right? It's benign, or it's a folinic acid. Is
that's exactly what it is.
Yeah.
Yeah, and the downsides, I mean,
You need a
nothing.
prescription, though, I think, for everybody. Do all states need a prescription for leucovorin,
You
as far
do.
as you know?
You
Okay.
do. It's a prescription. And there are supplements that you can take. So there's a couple companies that are targeting autism patients that know that they can't either afford or get the prescription. So you can take it as a supplement. And kind of higher doses, they're usually powders and they're like 5 milligrams a scoop. So some patients do that.
Speaking of affording, you're talking about a lot of tests. One,
Yeah.
does insurance usually cover this or not? And
Yeah.
two, if someone is paying all cash,
Yeah.
then I could see going to those end product things and skipping maybe some of the more elaborate testing. Does that make sense?
Correct. Yeah. I mean, it is a lot of money, but the goal is to figure things out. I tell patients like, look, we're
Right.
not doing every one of these tests every year. And you get so many answers. You really get a snapshot of what's wrong with your specific child. Like what are the metabolic processes that are going wrong? Because it's different. Like even my own kids, it was
Yeah.
different. So it's a lot of this is, hey, are you willing to spend 3 or 4 grand to really get a good picture of what's going on in your kid's body? And most, parents are like, well, we'll figure it out. But if obviously I'm sensitive to that, and yes, we can try things empirically. We can start slow. We don't have to do every test. Some things we can use based on clinical suspicion and just, and then the
Insurance does or
patient
does
response.
not cover most of these in your,
Oh yeah, so the
you have
insurance will
insurance.
often cover they'll often cover the blood work. They
Okay.
will. Not always, but often. They don't cover the folate receptor antibody test. And then, but like some of the other like microbiome testing, they're not going to cover. But things like MTHFR, yeah, they'll
Never
cover
had
that.
a problem with that one. Yeah.
Yeah, no,
And
they'll cover
a
it.
lot of, because these companies with these huge genetic panels
Yeah,
really want to get their product out there, they'll often eat all the cost for
yeah,
patients of mine that can't afford it.
yeah,
So they'll either have like a 250. They're more concerned with getting their product into the medical ethos, if you will.
yeah,
So they're very, very generous as far as helping patients out.
yeah. You can. There's ways around it. Yeah, absolutely. But then oftentimes the insurance will cover the blood, so that's helpful.
Good. Yeah.
And then if patients tell me, look, I can't afford, I get one test, we have this much money, or, and okay, then we work with that. I mean, I understand, absolutely. And there's still a lot we can do. I mean, my empiric, when patients come in, I like to try omega-3 in general. It's calming. It is a good fat. Most kids are deficient. And there's really good clinical evidence that it helps. I think I mentioned to you before we started recording, broccoli, sulforaphane,
Mhm.
has a lot of good clinical trials, specifically with autism. And a
I
lot of
didn't know
parents
that.
report that
I
it's
mean,
really helpful for speech.
I knew it about cancer because of thank you, Rhonda Patrick.
Yes.
She's
Yes.
the horrifying girl, but that's the active ingredient of what's in cruciferous vegetables. So
Hmm.
when mom says eat your broccoli, that's sulforaphane.
Yep.
But yeah, so I did know it from that, but I didn't know it from the perspective of autism.
Yeah, no, it's a really big it's becoming big. So there's a lot of products. We can recommend supplements as like capsules. But now the marketing people, there's basically autism it's called NeuroBrock. There's gummies, there's liquids now that are easier to give. So they're actually targeting like broccoli gummies for kids with autism. And then parents are reporting pretty good results. And it basically helps with liver detox. It helps with all three phases of liver detox. It has some really potent antimicrobials, so it helps balance the gut. It increases heat shock proteins, so stimulates that immune metabolism. I mean, it's got a lot. And most kids, if they can eat it, will tolerate it well. I mean, parents complain it tastes like broccoli, and kids will not like that. But when the kids take it, the parents say, "Hey, they're more calm. They're happier, less stimming, less repetitive behaviors, better speech, better eye contact." So, the detoxing, helps. And then magnesium is another favorite of mine that I often start kids on at the beginning. Magnesium glycinate is a great form, especially for calming and sleep. And oftentimes these kids are constipated, so figuring out different magnesium forms will be really helpful for their detox. I mean, I have a lot of kids that just treating constipation will improve their symptoms a lot. So these
Yeah.
kids are backed up
Well,
for
again,
days,
you're not
weeks.
treating constipation only, you're treating the gut, which
Of
again,
course, of
all
course.
the stuff that can go along that way. Cool.
Yeah.
So since we're focusing on a little bit, so omega threes are basic,
Yep.
sulforaphane is basic,
Yep.
magnesium, vitamin
Yep.
D, zinc.
Yep. A
Um,
lot of it, and two B12. So you can do either, sublingual, they have nasal sprays, shots can be really helpful. Actually, we do prescribe some B12 shots that can help kind of recycle glutathione, help that methylation. So a lot of kids actually report better speech with B12. Um, and then the last one would be the leucovorin, and that's kind of more or less. I mean, there's a lot I can put at a new patient visit, but those are some good places to start.
so then you have this 2 hour initial visit. Then
Mhm.
what's the kind of your protocol or what do you like to do?
Well, then, I mean, you mean afterwards or?
Yeah, it's like they follow
Yeah,
up
so
in
we
2
we do
weeks
all the
or
testing.
4 weeks
Yeah,
or
yeah.
something.
We do all the testing. I give them a huge treatment plan. Like, you got homework, you guys. Sorry about your homework. And, it takes them usually 6 weeks or so to implement everything. And then we get the test results back. And then we review it, tweak the treatment plan, what worked, what didn't, and then what further the labs say, because we're initially treating empirically. And then we'll treat based on the labs. And response. And a lot of times that's when the mitochondria for me, I know every clinician does a little different, but for me, that's when I usually start ramping up mitochondrial supplements. So, because that's what I'm testing for a lot in the blood. So I'll look at carnitine, which Carnitor can actually be a prescription, which is helpful if they're deficient. Um, and CoQ10, so ubiquinol can be really helpful. PQQ can be helpful. B vitamins. So we have a lot of, multivitamin I like that we use, but there's a lot of different ones. But B vitamins can be very helpful. So B1, B2, B6, B9, B12. Yeah. So helping with mitochondrial and the mitochondria, when you ramp up the energy production, it helps with speech and cognition and actually helps detox the child. So it's really, yeah, there's a lot going on. And yes, and if we do have suspicions of metals at that third visit, maybe we do a metal workup. I know you were asking about that.
Yeah.
And that's maybe at the point where we look at that.
Do you find zeolite helpful? I mean, a lot of people talk about zeolite as being helpful.
I've say, just yes, I do see it helpful in a subset of patients. Certainly not all. I don't think it's the be all end all. I've found it really helpful for lead. So when I have patients that are like zeolite's really good for me, I'm like, okay, let's check out your metals. And it does seem to bind to lead, and the kids get better. Now, how much it's excreting, I don't know. I don't know that it's actually pulling a lot from the tissue, but it is binding it in the serum. So yeah, I mean, I think it's relatively safe. I haven't heard of a lot of toxicity
And
from
it's
it.
expensive like crazy. I'm still using the original bin that I bought like 2 years ago.
Yeah, exactly. So I think it's fine if patients say it helps, but I have a lot of patients on the flip side of that they've heard about zeolite and they're like, we've been using it for 2 years and we haven't noticed any difference. So I'm like, well, then it probably
What
should
about
stop it.
creatine? I've gotten more recently exposed to the benefits of creatine.
Yeah. Yeah, I mean, I there's a couple studies with creatine and autism. It's not widely studied, but I like creatine in general. It's kind of that, as Dr. Fry explained it, it's kind of like the battery for ATP. So it actually stores up ATP, unlike other molecules. So that's why it can help with exercise and it can, especially like people with fasting intolerances and nighttime waking and things like that, and muscle recovery. So yeah, it's another one we can absolutely, and I do sometimes recommend it. Um,
Cool.
but the number one is carnitine for autism specifically. Carnitine and CoQ10 are the most studied
Okay.
for
Cool.
being clinically helpful.
Okay.
Yeah.
So, getting back to that initial patient, so she comes in, or he
Yeah.
comes in, or parents come in, obviously,
Yeah.
and you do the initial testing, you give them their homework, and
Yeah.
then I'm guessing you're going to say that you modify based on what's working or not working.
Yeah. Yeah. I mean, I don't, I don't have all the answers. I wish I had a crystal ball or,
How many
but
patients, how many autistic children do you think you've seen in 9 years, roughly?
I don't know. Um,
Talking hundreds, thousands?
I mean, at least hundreds. I don't know.
And
They're, like I said,
what
hmm?
percentage of them have improved with your approach?
Oh, probably most. I mean, it depends on what you define as improved, but have they made progress? Yes.
Have
I would
any
almost
have
all of
any?
them.
Yeah, I was going to say I would assume it's all of them based on the degree of improvement, but
But of
has
course, that's biased because I think a lot of kids improve with time anyway. I mean, I think that depending on injuries and, you know, I, yeah, it's hard to know how much I'm helping, but I do see most kids improve. And I think that there are certainly things that we can do, even from a standpoint of like sleep, even if we can just help one aspect of their lives. Like
sleep is
there's
tough,
usually siloed things we can definitely help.
right? And obviously, it depends too on what your starting point is, right? I mean,
Yeah.
if you have a family who brings in a child who they're already 100% organic
Yeah.
and never go to junk places versus the ones that I see where if we just try to limit their soda intake down
Yeah.
50%, we're making improvements. So
Yeah.
obviously it depends on what you're starting with.
Yeah, there's that and like I said, every child is different and you know, it's not always predictable. Like Mike in my particular case, like my son that regressed more severely, he had a poorer outcome. And statistically speaking, the regression he went through, he was not going to do well. But he actually lost his diagnosis much sooner and recovered quicker and versus my other son. So, it's you wouldn't have guessed that 10 years ago.
Yeah.
But so it's really hard to tell. And I really don't make promises, but yeah, most kids we can see some kind of improvement. Absolutely. I mean, treating just something as simple as like you said, treating the gut, treating constipation, treating fungus. All these kids are yeasty. Almost, I mean, most of them they have either candida or, some kind of fungal overgrowth. And it drives a lot of behaviors, and treating that can help a lot of kids. Certainly not all
Well,
of them, but a lot.
this is not as crunchy as some stories, but I do remember Mark Hyman one time talking about a teenager or an early teenager, I think, and she had like psychotic behavior. She was very, very. I mean, their family was in chaos, and
Yeah.
it was really. And he talks about antibiotics, even
Mhm.
like totally changing this entire personality.
Oh yeah.
And,
Oh yeah.
guys like me tend to not like antibiotics. And does that story sound familiar to you?
Abs all the time. I mean, we prescribe antibiotics a lot, unfortunately. I try not to, but we see when you test these kids' guts, I mean, they'll have Proteus mirabilis, Klebsiella, Pseudomonas. I had a kid with salmonella, all kinds of parasites, different kinds. Toxic E. coli, and Clostridia, difficile, C. diff, like over all the time. I mean, and so you have to, I mean, you have to treat it. I mean, it's criminal to not. These kids have horrible, foul-smelling stools and bloating and, maldigestion. They're literally skinny, and so treating it, sometimes the kids recover overnight. And it really, especially with self-injurious behaviors, aggression, really that irritability, anger piece, if they're just really not happy, look at the gut. I mean, there's other reasons, there's other things to look at, of course, but um, yeah, we use antibiotics. I do.
Yeah.
And
So
sometimes we need
I
to.
have learned through the last few years a lot about lipopolysaccharide or
Yep.
LPS. Does that come up in conversation? Do you see a
Yeah.
connection?
Absolutely. The gram negative, these gram negative bacteria produce these toxins, and
Right.
most of these kids have increased intestinal permeability. So
Right.
it's contributing to a
Otherwise,
huge amount of
for the
inflammation and
audience,
autoimmunity. Yeah.
for the audience, that's leaky gut. So,
Hmm.
we have these, we have mucin, and then we have these tight junctions. And when those things are broken, the toxic chemicals that should stay in the stool and go to the toilet ends up crossing over into the interstitial space and ends up getting into your blood, crosses the blood-brain barrier. I don't know if you've watched it, but there was a movie on Tubi that I tell a lot of patients about. Have you heard of Healthy Diet for a Healthy Brain?
No, but
It's a
I
good
don't
one.
watch a lot of TV,
Yeah,
but
it's a
yeah.
good one out there. And they bring up these prison population
Okay.
studies where all they did is give B vitamins and aggressive behavior dropped by 50%.
Yeah.
And what they were monitoring was, the discipline for violence, which, solitary confinement, that's what it
Yeah.
was. So they measured that as the outcome.
Hmm.
All they did is give these prison guys vitamins,
Yeah.
specifically focusing on B vitamins,
Yeah.
and violence went down 50% in a
Yeah.
week or two. It was just amazing how simple.
Yeah. No, I mean, there's that it's probably helping out, the mitochondrial function. And when
Yeah.
energy is up, you generally feel well. You have a sense of well-being when you have high energy, right?
Right.
Um,
Well, and
and
again, getting back to LPS, that's a
yeah.
very pro-inflammatory. And when that's in the brain, then it's anxiety,
Yes.
stress. I mean, people are going to be insulted and they're going to react when they're in that heightened state of arousal and inflammation versus healing that, calming it. It makes perfect sense. It's just
Yeah.
impressive how well it works. And, prison populations are great for studies because you can actually
Yeah.
control the diet, right? It's
Yeah.
versus someone else who goes to McDonald's and cheats. They may not tell you that.
Yeah. No, yeah, and as a clinical, pearl to your patients or the people listening to this, LPSs are really well treated with Motrin, ibuprofen. So that actually grabs the LPSs and decreases the inflammation. So if you have a child that's, biting, hitting, kicking, aggressive, and you give them some Motrin and the behaviors calm down, and it's kind of like, oh,
That's
it's a big
diagnostic.
indicator. I
Yeah.
think in like, okay, we got to look at the gut, we got to balance the microbiome. Maybe we go up really high dose probiotics. Maybe they need antibiotics. Sometimes I use herbs, but absolutely Motrin can be a big trigger for to see is that a problem? Is
Yeah.
that really causing this behavior? Because it is sometimes it's overnight too. You can give him Motrin and he's calm, and then it wears off and they're hitting again. So
Interesting.
yeah.
So where would you like to go from here?
Well,
So NicoleRincon.com.
yeah,
That's one big take home. The other
yeah.
take home is you can make a positive impact in these kids.
Hmm.
It may not happen quickly, or it
Yes.
may happen quickly. And I
Yep.
guess again, it's whatever scenario you're starting with the child. And
Yeah.
but obviously, processed foods, high fructose corn syrup, dyes. I mean, is there a list of things you give patients to avoid going forward that are kind of known bad guys?
In general, I mean, I try not to overcomplicate it. The initial appointment, I say organic because organic takes out the dyes and the
Right.
high fructose. I mean, it takes out a lot, right?
The
So just if you try
glyphosate
to,
is there and all, and yeah,
yep, yeah. So just focusing on organic really does take out a lot of the bad guys. And then I told them focus on the good fats. Try to take out, a lot of the inflammatory
seed
oils.
oil,
Really.
yeah,
I'm sorry.
seed oils, in other words.
Exactly. And a lot of it, so I recommend coconut oil, actually is an antifungal, antibacterial compound, and it actually has MCT, like medium chain triglycerides, which help mitochondrial function. So it's got magical properties. I love coconut oil for healing, but also olive oil, even avocado oil you can use, and then ghee, which is clarified butter. So it's butter with those proteins taken out. So anyway, good fats, organic. And then in general, we'll try a dairy-free diet because dairy actually triggers those folate receptor antibodies. That's the trigger. So a lot of kids go dairy-free, and then those antibodies go
Even
down.
organic. That's key
Correct.
there. Yeah.
And or even organic, even raw dairy, whole dairy, it's all cow's milk. Actually, so there, Dr. Quadros did a study looking at how allergenic it is, and dairy was the worst. Camel's milk, actually, I think I misspoke. Actually, I think camel's milk was even more allergenic. So it was more immune stimulation
Yeah.
stimulatory.
I think dairy milk is really, really good
Yeah.
for calves.
Yeah. Yeah. But ironically, goat's milk was less. So goat's milk was the best milk if you're gonna have a milk. So, but I just tell parents, just take out the dairy. So
Yeah.
that's usually my initial recommendation. Some kids we actually end up going gluten free too, especially if there's a family history of celiac or any kind of gluten problems. And just sometimes taking out gluten and dairy, organic, it makes a huge difference. Huge difference.
Yeah.
So that's a good place to start. So for parents, that's a thing you can do. Treating the constipation, make sure your kid's pooping. Magnesium's great for that. A few supplements to start. Um, yeah, I mean, and then like water, I just want to throw out there too. A lot of parents come in, they're drinking tap water. And I'm not a big fan. In my municipal water, there's arsenic, a lot of arsenic where I live. And I see kids, I'll test them and their arsenic's high. I'm like, are you drinking tap water? Well, yeah, so just be careful. I get a reverse osmosis filter, and then I add in some minerals back in. But yeah, basically,
Has iodine come up in your world yet?
I mean, iodine is common. We do test for it and we prescribe for it with thyroid deficiencies. So definitely selenium and iodine, and zinc if there's thyroid issues we need to look at. So, but yeah, I don't normally investigate it unless there's thyroid issues.
Okay. Well, again, go to your website, Rosignol Medical Clinic. Is that what it's called?
Yeah, so I work at rosignolmedicalcenter.com, but like you said, I have a website,
Yeah. Now,
NicoleRincon.com for my
so it's
videos.
not, you're not in San Diego then, you're in Orange County. Where specifically?
Correct. Specifically, it's Aliso Viejo. It's kind of South Orange County.
Okay, gotcha.
But
Great.
yeah, yeah.
Well,
But thanks for having me on.
yeah, thank you very much. And again, this is just going to go out to everybody because unfortunately, autism is a growth industry right now. And, we're on the verge of getting some really interesting information literally as we speak
Yep.
tomorrow.
Tomorrow.
So everybody in this world is anxiously awaiting to see what is stated and how it's received.
Yeah. There's so much hope. There is so much hope. I think we're going to have a ton of prevention from what's happening tomorrow. And also from if your child has autism, there's so much we can do. Please have hope. Contact me. Like I tell people, and just email me, follow me on Twitter, like send me a message. I'll answer for free. I mean, my life's goal is to help as many families as I can because I'm so blessed. I'm so grateful for my journey. I'm here for you. So if somebody, don't lose hope. I'm here. Please reach out. And yeah, and thank you for having me again. And, thank you for bringing this awareness, Dr. Hank. I really appreciate it.
Thank you. Bye bye.
Bye.